Good afternoon, Sarah. Thank you for coming in the office today and providing me with your food diary. The purpose of this dietary assessment is to identify if you may be at risk in regards to your nutritional and oral health. Nutrition, diet, and oral health are closely interrelated. So I have a couple questions for you regarding your meal summary report. I see that you drink coffee daily, is that correct?
Yes.
Okay. And do you add any sugar or cream to your coffee?
I don't add any sugar, but I do add creamer.
Okay, and do you know, is it sugar-free?
It is not.
Okay. And what time of day are you drinking your coffee?
Every morning.
Okay. And then do you usually drink it like all in one sitting, or do you tend to sip on it throughout like the morning while you're getting ready?
Yes, I do. I sip on it.
Okay. All right, that sounds good. Next, I'd like to discuss your consumption of soda. I see that you like to drink Diet Coke, is that correct?
Yes.
Okay, and how many cans do you drink per week?
Typically a can with lunch every day during the school week, so 5 a week.
Okay, and then do you drink it all in one sitting with lunch?
Yes, and I typically finish it with lunch.
Okay.
I'm done.
All right, thanks for that information. And then I also noticed that you like to eat blueberry bagels for breakfast throughout the week.
Yes.
Okay. As you may or may not know, these bagels have what we call hidden sugars. These foods are not just the obvious sugar foods like candies and sodas. However, they are classified as fermentable carbohydrates. And fermentable carbohydrates, they break down into sugars in the mouth, allowing the bacteria in your mouth to use the food into acids, which can usually or eventually lead to tooth decay. So next, I'd like to discuss the dental caries process and the 4 factors that are involved. So you have to have all 4 of these factors here to get a cavity. So the microorganisms or bacteria, we know that you have that present in your mouth. You had shared with me that you had a filling about 4 months ago?
Yes.
Okay, so everybody has bacteria in their mouth. It's just a specific bacteria that causes this decay.
Okay.
Okay? Also, you need to have the cariogenic diet, which you do have. So that would be like the soda, the creamer that's not sugar-free, and also the fermentable carbs such as bagels. And I'd also notice you like to eat potato chips a couple times a week. Is that correct? Okay. And those all put you at risk for developing possibly another cavity. These foods also, they lower the pH of the oral cavity, making it more acidic, which can put you at an increased risk for a cavity as well. And the third is the tooth resistance. So that's just like a weakened or a susceptible tooth, which can put you at risk for decay as well. And then the 4th is salivary factors. So I know you're not currently taking any meds. However, if you were in the future, I just want you to be aware that some medications can reduce the salivary flow, which places one at a higher risk for developing a cavity as well. Because saliva, it has a cleansing property, and when there's a decrease of the saliva, bacteria are able to thrive in the oral cavity. Okay? So next I would like to discuss frequency versus quantity of these foods. So frequent eating or snacking causes the pH of the oral cavity to remain at an acidic level, which puts one at risk for decay, versus consuming 3 meals. So, your breakfast, lunch, and dinner with no snacking simply decreases the pH to an acidic level only 3 times a day, which is ideal in maintaining optimal oral health while decreasing the risk for decay. So next, I'd like to talk about your periodontal health. And what that is the health of your gums and the bone and all the supporting structures. So you have great home care, which I encourage you to continue. However, if you are unable to continue excellent home care, it can progress. So I have you at a type 1, which is healthy teeth and gums. So you have pink, healthy gums, which is great. And then also there's no bleeding on the gums that I saw while I was in there probing and flossing. And also to your x-rays had shown that there's no bone loss present. So this is great, this is ideal, this is where you want to be.
Great.
And, however, if you weren't able to keep up with this home care like you are now, it can progress to gingivitis. And what gingivitis is, it's the start of a disease process. So you get the red swollen gums here, as you can see. And then also too, bleeding when you're brushing or flossing is possible. And then also too, at this stage there is no bone loss, so it is reversible. So if you were able to get back to, you know, your good oral home care, you can reverse it back to where you were.
Okay.
All right, do you have any questions about that?
Oh, that sounds great.
Okay, so the removal of food debris by brushing twice a day and flossing will ensure and maintain your excellent periodontal health. If removal of the food debris does not happen, like I was saying, consistently, this is how the bacteria ultimately can cause destruction of the gum tissue and the bone, resulting in what is known as periodontal disease. So overall, the health of your oral cavity is great, and I want you to continue to brush twice a day, floss daily, and continue using toothpaste with fluoride. All this will help to strengthen your teeth and keep your overall health good.
Great.
So I just have some goals I'd like to discuss with you and see if it's something that you can possibly incorporate into your everyday. As far as when drinking coffee with the creamer, 2 recommendations. Finding a creamer that is sugar-free, and then also if you could even just rinse with water when you're done drinking the coffee would be great. Do you think that's something you could do?
Definitely.
Okay. And then also too, when you're drinking your soda, I don't think I asked you, but do you drink through a straw?
I don't.
Okay. So that's another possibility that we could have you do is drink through a straw.
Sure.
Okay? And then the days that you're eating bagels in the morning, do you think you could maybe incorporate brushing after?
I think so.
Okay, so that's going to help, you know, get that acidic level back to basic and remove that food debris.
Okay.
All right, do you have any questions for me at all?
I do. What type of mouth rinse would you recommend for me?
So I would recommend, it's called ACT. Have you heard of that?
I think I've seen it at the store.
Okay, yeah, you can just find it at your local Walmart, Walgreens. And ACT I would recommend, and it contains no alcohol, so that's great. And yeah, I think you could give that a try.
Okay, great. I'll look for it.
Okay, any other questions?
I think you've covered it all. Thank you.
Thank you.